to leave this earth helping thousands of children. I can't imagine a better thing.
New tonight, a push to expand Oregon's caregiver workforce and a follow-up to a K2 investigation into how the state cares for the most medically fragile Oregonians. A K2 investigation found a shortage of caregivers leaves some children without critical care. K2 investigator Wright Gasway is at the live desk with this new legislation going before lawmakers this month. Right, it would apply to hundreds of families statewide.
Yeah, children with the highest behavioral and medical needs. Advocates say the state is not living up to its promise, largely because it doesn't have a big enough workforce.
They call him Senator Tenzi at the Capitol because we're there so much.
9-year-old Tenzi has become one of the faces in the push to expand Oregon's caregiver workforce. Lawmakers took a big step towards that goal in 2023. They created a program allowing parents of the most severely disabled children to get paid up to 20 hours a week for care. However, the state's budget only covered a fraction of the 1,500 eligible children.
The state does the rigorous, stringent testing that says that he is institutional level care.
Advocates like Callie Ross are back in front of lawmakers this year with a clear request.
We're asking that you come back and say, yes, these children are all eligible and they should have the access that we said they should have 2 years ago.
A pair of lawmakers hope to do just that with a bill named Tenzi's Law.
It's going to be Senate Bill 538.
State Representative Courtney Neron and State Senator Deb Patterson are sponsoring the legislation to allow every child who qualifies to use their parents for a certain amount of care. Representative Neron says it's one of the easiest ways to address the critical lack of caregivers across the state.
These families and children who need this bill are in all of our districts. We, across the state of Oregon, have a crisis of care. We need to be working toward solutions.
Our investigation found at least 2 states, Minnesota and Arizona, already allow every eligible child to take part in similar programs. Advocates say paying parents allows many of them to get off food stamps and other government assistance, saving taxpayers money in the long run. Callie says expanding the care program is her son's legacy.
So my goal with TENS is to be as visible as possible, be that face, be that voice to say these children are real, they exist, and they need to be cared about.
One note on the care, the state determines how much care these kids need. Data we got from the state in a records request shows about 40% of that care was not being provided between 2018 and 2023. There are a range of reasons why. However, Callie and others tell me the workforce shortage is a big reason why. At the live desk, Wright Gasaway, K2 News.
Right, thank you. Also